Hello, everyone, and welcome to your orientation. My name is John Benko. I am the Director of Nursing here at the Belfair campus in Shaker Heights, where you would normally be for an orientation if it weren't during the time of COVID. So I thank you for accommodating us by joining via Zoom meeting, and thanks to the HR team for putting that together. I'd like to just spend just a few seconds to let you know that we do have a health clinic here. And what that health clinic on the Belfair campus does is provide for health support for all of the clients who are in residence here. We've got about 90 or so clients who live on the property, and we make sure they get their meds every day. We make sure that we screen them for symptoms of COVID-19 or any other ailment for that matter. But we do maintain a strict COVID protocol for those clients who live here. And we make sure that we provide both their medical attention insofar as their meds, as well as any assessments they might need. We also help coordinate it with the residential staff and our team of health professionals, any appointments that might be necessary or referrals that we may have to get somebody over to a mid-level provider at our Willow Grove Wellness Center or someone even off campus. So when it comes down to anything with medicine or health, that is what we do at the health clinic. My name again is John Benko. I'm the director. We have Michelle Parsons, who is our clinical nurse manager. You may have some exchange with her. And we've got a team of about 20 or so nurses who staff this campus from about 6:15, 6:30 in the morning through 10 p.m. Every evening. A little different on weekends and holidays. I think we leave a little early. But other than that, we're available for anything you need there. We do have a triage line. If you have clients that need help, we ask you to dial 8200, let us know what's happening. And we're available via radio for any emergencies. And we do respond to all emergencies that may involve medical care for any of the clients. We also do some education. So certainly the nurses are involved in helping educate the clients and staff. You may see Michelle Parsons or myself available out there to talk to individual teams or to do a group education process where we help bring things of related to health and care of the clients to the staff. So that in a very, very brief and broad stroke is what we do at the health clinic. And it's what we've done for, 149 or almost 150 years until the beginning of this year when we've had some additional responsibilities due to the pandemic. So since COVID-19, we also do a couple of other things, and that is we work with leadership. We work with the environmental teams here to make sure that we get the PPE and appropriate cleaning materials out to everyone. And we help develop policies, and we help monitor and work with the health department whenever we do have a positive or a suspected positive case. I have to say that we are very, very fortunate, and it's due to the hard work of all of the staff here that we have not had any positive adolescent clients. So none of our residential clients have had any symptoms or been diagnosed with COVID-19. We have had a handful, maybe a little more than that, of our staff who have, through one form or another, become positive and had to miss work for some time. One of the ways we mitigate that, of course, is we screen everyone. So as you come onto campus or any of our campuses, you will be screened. You'll be having your temperature taken and you'll answer some health questions. We'll also have you masked, which is the mandate, of course, around the state, but we've been doing it for a little while longer. Here on the Belfair campus, you'll see most of the staff that's facing our clients will be wearing a surgical or isolation mask. From time to time, you may see an N95 type mask, which is more of a respirator mask. And we do have some of our support staff still wearing some cloth face coverings, which is certainly appropriate. Anytime that changes or you need additional education or additional supplies, or we need to roll out widespread use of an N95 type, that will come out of the health clinic, and we will make those determinations and that information known to supervision. Supervision will get it and the appropriate equipment out to you. So those are things that we help coordinate. We try to do some education around COVID-19 and what the appropriate mitigation factors are. We do that through videos. You can find them on the portal. And we're certainly available to meet with any team or group of individuals that may need some additional remediation, or if you just want to touch base, ask some questions. Certainly run that up through your supervision. They have been asked these questions many times, and we have worked with them to get the appropriate answers, so they probably have them already. If not, you can reach out to me, or they can, and we'll get you that information. So we want to make sure that you're following all those protocols. They do change, and we get that information updated out to you. But basically speaking, we're going to need you to help by cleaning up. And by cleaning up, we mean good hand hygiene, right? We want to make sure that we're constantly washing our hands, either with a hand sanitizer or soap and water. We want to keep our work areas clean. That's our responsibility to wipe down our frequently used frequently touched items a couple times a day. We certainly have an environmental staff, but we need everyone to pitch in and do this. We need to keep our areas very clean. That's important. We also need to cover up. So we need to make sure that we are wearing our masks. Whenever you're not in a room by yourself like I am right now, you need to be masked. That's a government mandate. It's a mandate we have had here on campus for quite some time. So we'll provide masks for you, whatever's appropriate. We need you to be wearing it. So you need to clean up, cover up, and of course you need to back up. Anywhere it is clinically feasible, we need you to keep that 6-foot distance, right? So you need to make sure that you're sanitizing, make sure you've got good hand hygiene, make sure you're wearing your mask, and make sure you're employing social distance wherever we can and wherever it is physically both clinically appropriate and safe to do so. So we're going to keep doing these things. We'll keep you updated on anything that we can do to help you. You can certainly reach out to me at benkoj@wingspancg.org. I'm happy to help any way I can. I want to once again welcome you. Thank you for taking the job. This is essential work we do here. It's now more important than ever for our clients and our families that they get the support that only we could provide them, and we can't do it without your help. So thanks for joining the team. I'll turn you back over to the HR group there in the training center, and I think they're going to probably introduce you to some folks from IT. In any event, have a great day, welcome, and be sure to say hi when you're on the Belfair campus. In the meantime, look after yourselves, wash your hands, and stop touching each other. Bye now.